Hello, welcome to the Michigan Center for Regenerative Medicine webinar, June 2025. I'm Dr. Robert Farhat. This is Dr. John Santa-Ana.
Hello.
We're coming to you from our physical therapy gym at our new location at 355 Barclay Circle. Today we're going to talk about post-procedure protocol, meaning after you get a stem cell procedure or a PRP, what happens afterwards. So there's several things that we talk about during our consultation. One of the things patients always ask us is, what's the recovery like? And it's nothing like you would think. It's much easier than surgery, but there are some restrictions that we have to follow.
Yeah. So when a patient comes in with a consult for procedures, a lot of times a lot of the patients are focused on the procedure itself, because that's a novel idea. Talking about regenerative medicine treatments with image guidance, with our lab and proper dosing. So those are all really important things to cover. But the other important piece of this is your recovery. So the procedure day itself is a pretty straightforward procedure. Everything's done during that day. But a lot of your outcomes are also going to depend on how your recovery and your rehab is going to be. That will potentially determine the outcome of your procedure.
Yeah, so actually post-procedure kind of starts pre-procedure. So some of the things we talk about are limiting your anti-inflammatory medications, certain medications we have to be concerned with for the procedure, some that you may not think about, like blood thinners, those kind of things. After the procedure, we do have sort of a protocol we have followed, and that's mainly because of how the body heals. So we talk about post-procedure protocol. We want to talk about exactly what happens after the procedure. So there's 3 phases of healing. First phase, and first thing the body does to heal is it creates inflammation. So the first few days, up to 10 days, symptoms can be a little bit worse. And because of this inflammatory process, we actually want the body to inflame. So we don't want to blunt that whatsoever. So the first part of the healing cascade is no anti-inflammatories. So after a lot of these procedures, they can be somewhat uncomfortable. Certain ones are a little worse. So we actually try to preemptively prepare patients and get them medication ahead of time. So a lot of times we'll use like muscle relaxants or sometimes even painkillers to help with the post-procedure care. So after 2 weeks afterwards, we don't really want to blunt this inflammatory response. So that's one of the first key steps. So the first step is inflammation. Second stage is proliferation. So where the body tries to start to produce and bring in normal, healthy growth factors into the area that we injected, which can last up to about 30 days. And then after that is where the real remodeling happens, where the body essentially starts to develop these normal, healthy tissues that we're trying to start with our injection process. And that can go up to 90 days, and stem cells have shown sometimes up to 9 months beyond the injection date will continue to remodel. So everybody's very anxious to get back on the road to recovery, and we always have to remind patients that it does take some time. So we're actually implanting these stem cells into the treatment area. So we wish people can just jump off the table and then be ready to go the next day, but it does take a while. So around the 4 to 6 week mark is where we're looking to make improvement. Closer to 8 weeks is really where we expect to see symptomatic improvement.
So the protocol that we have for post-procedure pretty much circles around these 3 concepts of tissue healing. So during that inflammatory phase, usually it's the first 3 to 5 days after the procedures where you have that inflammatory phase. Primarily the goal for that is just to get the pain management under control. So that's why we kind of talk about using heat, kind of using red light, using muscle relaxants, some pain medications, getting your range of motion going. So really just very simple things like that. With the second phase, which is proliferation, that goes on for about 3 to 4 weeks after the procedure. That's when things really are starting to settle into your body. That's when I tell my patients that usually that's when things are still pretty fragile in there. So you don't really want to push your body structure that we're treating, but you do want to give it a little bit of range of motion to kind of just enhance some movement in there and also to enhance like vascular activity into the area. Using supplements and things like that can help with the proliferation phase too. And then the last phase, the remodeling phase, that usually happens at around 4 weeks after the procedure. And like Dr. Farhad says, it goes all the way up to 9 months after that. That's when really the tissue will start to change. And then that's when we really want to start to encourage the tissue to heal. And by doing so, that's when we encourage physical therapy and rehabilitation, challenging the tissue and gradual return back to activities when that happens.
So just to sort of summarize, so the first phase of recovery is inflammation, and we don't want to blunt that inflammatory response. So the first week to a month, we sort of want inflammation to happen. So people have trouble not taking their anti-inflammatories, which is, I understand that, but at least 2 weeks of no anti-inflammatory medication. We will typically provide patients with medication to help with symptoms post-procedure. We also think about bracing sometimes, yes or no, depending on the area and depending on the severity in which we're treating. Some things will require bracing. For instance, I had a patient that tore their Achilles tendon, so after their injection, you have to wear a boot for a little bit because we don't want that to tear even further or worsen. So things like that, we decide case by case. It's not always the same for everyone. And
sometimes bracing is pretty much just a reminder to you to kind of limit using that appendage, right? So for example, like a knee or something like that, or even your lumbar spine. So you don't really need to wear bracing if it's a different type of treatments that we're doing, but it's a good recommendation or at least a good reminder for patients to not go overboard with what they're doing and just kind of protect that area.
So the proprioceptive feedback is kind of just remember that we did something to this area. We need to sort of take it easy. Minimum 2 weeks. We'd like it to be a month, depending on the body area. Now, what does that mean to some people? So take it easy doesn't mean just lay around, do nothing. But we don't want to stress the area. So if you're an active workout person or you like to do these exercises of that particular body area, we ask you kind of take it easy for that 4 weeks. General day-to-day activities are fine. Even range of motion of that particular area that we treated is reasonable. And again, depends on the person, depends on how active you were prior to that phase.
So I usually tell patients like after that inflammatory phase, when that initial spike of pain goes away, that's usually a good indicator to show that you're able to do a little bit more. So usually during that proliferation phase, after the inflammatory phase, if you're feeling up to it, you want to do a little bit more than just range of motion. Usually I have patients kind of do your normal activities with walking and just kind of listen to what your body's going to allow you to do. If you're having pain by doing an activity, you definitely want to stop. It's not the time to push forward through the pain. If you're, so you just kind of really have to kind of listen to what your body's going to allow you to do. So the other important part of that proliferation phase is make sure that you have proper nutrition as well. So you want to make sure you have a good protein intake, you drink plenty of fluids. The supplements that we would recommend will also come into play during this whole process. It's just to kind of help your body kind of use all these tools to kind of repair itself.
So we're going to just recap. So the first 4 weeks, we don't want to blunt the inflammation, range of motion. We have some restrictions for that first 30 days. The next part of the proliferation, the healing phase, we want to start to integrate some activity. And 4 weeks after we see patients after their first 4 weeks, then we decide whether or not is physical therapy actually needed, or do they feel comfortable enough to maybe do their own physical therapy program or just a home exercise program of some type, trying to sort of start the stress in that area that we treated, because again, that helps with the collagen development of that proliferation phase. And then the key is supplements and nutrition. So we're trying to build these complicated proteins in our body, so that requires adequate nutrition, protein intake. Sometimes, like Dr. St. Anna said, we supplement with the medication options that we have here, again, to boost the system. Some people are already doing that before we even do their treatment. So maybe just integrating that or just refining what people are already taking and just make sure it sounds appropriate. And then that second month, really, you start to ramp up your activity level 4 to 6 weeks. You really start to get going. You increase the activity a little bit by each day. And I use the method of if you're doing an activity and you're sore for a day or two, which is pretty normal, you're probably doing an adequate amount of activity, and then you can escalate it up. Usually around 6 weeks, our restrictions are pretty much off at that point. You can go back to your sort of normal routine, stressing the area a little bit more within reason. And again, we want to ramp it up that second month. So the proliferation phase is kind of where your body is bringing in these normal healthy growth factors to kind of put together the construction materials and get you back on to recovery. The last phase is definitely the longest phase, which is the remodeling phase. We just want to increase what we did in step 2, so the proliferation phase. So we're going to increase the activity more, plus or minus physical therapy, plus or minus resistance training of those areas. And definitely the supplements and the diet are critical to continue to improve the remodeling phase. And that, again, that can last for months afterwards.
Yeah. So usually for our protocol here is that usually after your procedure at 4 weeks, when you know your remodeling phase starts, that's when we usually have you do a follow-up so we can kind of see how you're doing. And if you're doing well and progressing as we would expect, then we would remove your restrictions, and then that's when we'll give you the liberty to be able to gradually return back to your prior level of function with the assistance of physical therapy usually. And then the physical therapy, usually what I tell the therapist is I want them to progress patients in phases. So normally I want them to first and foremost make sure they have good range of motion at the area that we treated. So after they reach that, usually after a week of therapy, then you kind of move over to some stabilization exercises, some eccentric type exercises to kind of get the strength and stability back. And then from there, you kind of move on to more strengthening. And then as you get closer to around 2 months later, so which is around 4 months, 3 to 4 months after the procedure, 2 months after the procedure, then if you are progressing really well in your therapy, then you can start working towards return to sport or return to activity that you want to do. So the physical therapists usually are very attuned to that, especially if they know sports medicine really well. They know how to progress patients when they're recovering from a procedure.
And we want to just emphasize that it's not like surgery, right? So there's major restrictions, sometimes bracing, can't do X, Y, Z. So we don't go that far, but there are some restrictions, and we got to be smart about these treatments that we offer patients. But there is a slow progression. Very rarely do we limit sort of weight bearing or complete non-use of that limb that we treated or the spine or whatever the case may be. But there is a recovery process.
Yeah. A lot of times too, like with these procedures, depending on how severe the structure that we're treating, if it's not too severe or you're recovering really well, a lot of times the hardest part with all of this is just kind of holding yourself back from trying too much, because you start feeling great after you haven't been feeling great for months or even years at a time, and you really want to start pushing it. So I always tell the patients that you got to be able to kind of hold yourself back when these things do happen. And physical therapy is not for everyone. Some people already had multiple courses of physical therapy and they know exactly what to do. Some people have different levels of fitnesses that they're really comfortable with how they are in tune with their bodies and how they heal and how they rehab. So they may not need this form of physical therapy. So we've kind of recently learned about this, another form of rehabilitation, which is a more passive physical therapy in a sense, which is actually assisted by robots.
Yeah.
And because of that, it's a nice kind of another option that patients can have, whether you want to try a different type of therapy or rehab that's different than what you've had before, or let's say you're still having a lot of difficulties with range of motion or tolerating your regular physical therapy, then I think the advanced robotic physical therapy does make sense. So we partnered with the Advanced Robotic Therapy here in Rochester, Michigan. They created a small informational video for you guys to share. It's very informational, and I hope that you guys find it useful as well.
All right, we're going to try it.
Thank you guys for passing it over to me. For everyone else that doesn't know me, my name is Corinne Montgomery. I'm the Director of Operations and a clinician in advanced robotic therapy. We have partnered with Michigan Center for Regenerative Medicine for our second location and have put a couple of robots in-house in their beautiful office suite over off Barclay Circle there. And I just kind of wanted to come on for a little bit to talk about the robots and clear up a little bit of confusion about them, hopefully, so that people know about this non-pharmaceutical, non-surgical option to achieve pain relief. Everyone is familiar with physical therapy. That's what I specialize in, by the way, physical therapy. And my physical therapist, Jack, in this video here, that's what our credentials are. Okay, so everyone's probably had a touch point with physical therapy. And this is really the next generation of physical therapy. So if you've gone through it before and you're like, okay, I did 40, 50 visits of physical therapy, and yes, I got the results I need, but the symptoms are back, and I don't have the time in my schedule to dedicate that amount to this effort. This is the solution that's come in, and it's going to effectuate change better than chiropractic or massage therapy, personal training. It's not that those things don't work, but it's kind of like taking a walk versus jumping in a Ferrari. This is going to be able to accelerate the change, get you to full pain relief and functional mobility faster than those other forms of therapy will. So this robot, though it looks scary and big, we as clinicians are still identifying what the issue is. We have a trained eye and years of experience that have taught us to be able to look at someone's body, look at the way they move functionally, take a few measurements, and be able to identify what muscles are misfiring in their body, and more importantly, how to treat specific muscles to have more of that global effect. So we identify the muscles, and then we place the robot onto that muscle. And in this video, I'm just kind of flipping through some placements, common placements that we do to give you guys an idea. But there's over 20 different placements that we can go into. I mean, we even go into the masseter muscle right here for people that suffer with TMJ disorder. Onto the temporalis for people that have migraines, into the plantar fascia, head, shoulders, knees, and toes, anything you can think about coming to standard physical therapy for, you can also come to robotic therapy for. Okay, the most common thing we see, obviously, is low back pain, just because it's the most common disability in the US, but we even treat like athletes that will come in to temporarily increase their vertical height or increase their sprint speed by optimizing their muscle function. So this robot, back to how it works, is capitalizing on something that's called trigger point release. It might be something you've heard of, but if you haven't, basically, if you have a tight muscle and you jam your thumb into it, after a couple of minutes, the brain will release a wave of chemical factors to that muscle as an evolutionary response and force that muscle fiber to go into the lengthened position. Okay, to relax that muscle, to take it out of that hypertonic state and put it in the relaxed position. But when I do it with my hands, I can only maintain that pressure 1-2 minutes. Jack, he's a big guy. He could probably do it for 3, maybe 4 minutes if he's lucky. But those results are only going to last like a couple hours at most. With the robot, it's able to maintain precise, exact pressure for up to 30 minutes at a time. So that's how we're able to get change. We're able to put that fiber into the lengthened position for like 24, 48 hours at a time. And what that results in is that after you leave the therapy with us and you go back to your daily life and you're walking and you're doing whatever you normally do, you really don't have to think about it too much, but just moving with your body in that new position eventually is going to reprogram the neuromuscular system to utilize your muscles correctly. So that's how we're able to permanently change the force distribution that's going through all your joints. We're able to take pressure off of nerve roots and get rid of that pain for you long term. This is something that has absolutely revolutionized the way that I practice. Just to give you guys an idea, my last practice, I worked with like the best of the best physical therapists across the multiple clinics that I did work at, we still averaged like 30 to 45 visits for a case of sciatica, getting someone that wasn't able to stand or sit comfortably to being able to go back and play with their grandkids, golf, whatever they want to do. Currently, my average for the exact same case is 8 to 12 visits. So it really has revolutionized the way that I practice. It's been incredible to give the gift of time and efficiency to my clients that I treat. I absolutely love it, and I know you will too. Now, No is a Michigan Center for Regenerative Medicine patient. We are going to offer you a free evaluation and a free 30 minutes on that robot. So please feel free to schedule. You can come in, you can have a taste of the robot, see what it feels like. It's absolutely pain-free, really comfortable, and
Oh, sorry about that. I was kind of cut short. Yeah. So what Corinne was trying to tell there is that for our patients, like they are going to do a free evaluation of 30 minutes initially to kind of introduce with the robot. So I think it's another good modality to use. And then I guess the last piece we want to talk about with post recovery treatments would be using peptides. So peptides have been kind of in the media now a lot in the medical community. It's been made popularized by things like Ozempic and semaglutide, which are peptides that are used for weight loss. But there are also, on the other side, there are also peptides that can enhance and improve musculoskeletal healing. So there's things like BPC 157, ipamorelin, sermorelin. Those types of peptides do help with muscle recovery and healing of musculoskeletal conditions. We found that when we use that in conjunction with our regenerative orthobiologic treatments, the outcomes have been phenomenal. So we've been kind of incorporating more and more with our patients. It's an option that we're giving for patients now, and I think that combination really works really well with recovery.
Yeah, so we're trying to sort of start patients, recommending maybe starting a couple weeks prior to the injection with the BPC, and then continuing it for several weeks afterwards. Again, we're trying to sort of catch you in this normal healing process, this cascade of regeneration. So it definitely helps with the healing process. Even just by themselves can help. We just think it adds a boost to our treatment in order to make the treatment more efficacious and hopefully long-term.
Okay. So I think we're going to go through a few questions here from the audience. The first one is question from Rick. I know Rick. So how soon can I start red light treatment after injections, and for how long per sitting and per week? So the red light therapy, you can definitely get that started immediately. Typically, after treatments, I do recommend to use ice and heat together only for the first day. After that, it's all going to be heat. Red light is one of these treatments that work really well in conjunction with what we do. Is a really good complement to what we do with the idea of getting the cells really active, getting the tissue to heal. So red light would be really good. As far as for how long, I would refer back to the manufacturer of your device and see what they would recommend. Next question is, when you start physio at 4 weeks, is it normal to be sore once you start? Add stem cell injections into the hip and back.
Yeah, so just like we talked about, just like any kind of deconditioning or sort of you step away from your normal activity level, getting back into it, you're gonna start to get some soreness. So what's normal soreness? Usually 24 to 48 hours, and then it starts to dissipate dramatically after that. So if you do a workout, you do your physical therapy, sore the next day, but still can function. And the second day, you get still a little bit better, but still a little sore. You're on the right track. You're along the right healing property. So, and if you're in formal physical therapy, you see the therapist usually every other day. It's great to get their feedback as well. Sort of, they will reinforce the symptoms you're experiencing, and because they're there with you, hands-on, one-on-one, you can get direct feedback. So I would utilize those things. But what you're describing, what's the name there?
Henrietta.
those are normal symptoms.
And you got to remember too, like the healing process with this can take all the way up to 3 months. So, so when you start with physical therapy at month 1, you still have healing to happen as well. So, and there's been evidence to show that it continues even beyond the 3-month mark. So don't worry when you're going through physical therapy that this is kind of still part of the process.
We just don't want you to be, say, miserable on day 3 after your exercise, right? Then you probably did way too much. So probably need to back down the intensity or the number of repetitions or the weight or etc. But sort of the typical 48 hours of soreness is reasonable.
Next question is from Rose. Is PRP the only treatment? And is microfat also an option?
Yeah, so microfat is an option, but it's limited on its application. So right now, we're looking mainly at peripheral joints or confined space. The spine, we're still a little, I don't want to say hesitant, but might have not as many applications as, say, the bone marrow goes. So for a knee, a hip, shoulder, micronized fat is adequate. But as far as the spine goes, I still think we're limited. But so not only do we have the PRP, the lipoaspirate or the micronized fat, and also the bone marrow, which is we consider the stem cells. So the stem cells have the bone marrow and the lipoaspirate or the micronized fat. Those two sort of go together.
Yep. And then we'll talk through all of this like during your appointment. When we go over your diagnosis, we'll discuss all these treatment options that's available, whether it's insurance covered treatments, pain blockers, or these orthobiologic options. So Danielle, I had PRP in my plantar fascia at your office 11 weeks ago, and I have a lot of scar tissue at the site of the injection. Is that normal at this point? It's kind of like a hard nodule. So I guess it depends on where you are in your phase of healing, right? So 11 weeks ago, typically you would have already had a follow-up here in the office at 4 weeks. And then normally we would kind of continue following you if kind of we're seeing things that kind of where it's going. So I would recommend Danielle to call the office here and set up a follow-up so we can evaluate a little bit better, maybe do an ultrasound in there and kind of see what's going on with that.
And you should be getting close to your 3-month post-procedure follow-up, hopefully, unless you're too far away to come to that appointment, right? If you're kind of remote, that might be more challenging, but definitely you need to come back and we'll check you out.
Yeah. Jeff asked, do you have physical therapists on site, and can you go to other physical therapists closer to home? Absolutely, yeah. So we do have advanced robotic physical therapy here on site, and they are extended a very generous offer to our patients. But if you choose to go to your traditional physical therapy route or go to one closer to home, you're more than welcome to do that as well. So either one is fine, and we'll work with you guys to kind of get to where you need to be. I guess we'll make this our last question. Lou's asking, is the stem cells and PRP injection still working after 6 months? So a lot of the data shows with this is that the stem cells and the PRP that we inject are transient. So when we inject it into the tissue, it helps stimulate the healing response that your body creates. But lab studies show that the cells that we created in there will not stay there long term. So essentially, they kind of like trigger a healing response. And then after that, it kind of cascades into more healing. And then you get this momentum of more healing and healing going over the next few months.
It's almost like we're sort of reprogramming the area to think about it appropriately, right? So the PRP, we think maximizes at about 90 days, but there's probably some plus or minus with that window. Stem cells are a little different because we're essentially trying to re-stimulate the area to activate and to start the body's normal healing process and develop these normal cells in the area. So that'll last a little longer. That could, like we talked about before, it could potentially go up to 9 months afterwards. So we're trying to, it's not like a cortisone injection where the steroid only stays in the area for X amount of time and then tries to get the healing process. We're trying to stimulate this sort of normal healing pathway regenerate and to work again. So the time frame is sort of, it's a sliding scale, right? So we're hoping that we continue to get improvement over time. So it doesn't just sort of drop off the shelf at that point. It sort of continues, and then part of this rehabilitation process, we're hoping that it will maximize the efficacy of our treatment.
Yeah. So stem cell is kind of interesting, and PRP, these orthobiologics, we're learning more and more how the body heals. So it's not a very static thing. It's very dynamic, and it's actually really complicated. But by putting these cells into structures that are degenerated, we're essentially waking up the dormant stem cells and growth factors they have in there to, like Dr. Pratt says, to kind of reignite that healing response. So, well, that's all we have for today. We appreciate everyone for tuning in. I hope that you guys picked up a few things here from our talk, but obviously this is like a big brushstroke of kind of things to do. So if you'd like to know more about what we do and our process and our treatments, and to see if you're going to be a good candidate for our treatments, you can give us a call here at the Michigan Center for Regenerative Medicine. Our number is 248-216-1008. We'll be more than happy to talk to you and figure out how we can help you best. Good night.
Good night. Thank you.